Well, there's a lot of laughing on the Big Party Morning Show. We can often thank Jeff DeGan for that.
He's great on air, but off, Jeff has long experienced neck and back pain.
Yeah, he's here. He's going to share his story along with Dr. Drew Drummond of the Spinal Balance Health Center. Good morning, gentlemen.
Hi, Jeff.
Good morning.
Dr.
Good
Drummond,
morning.
it's always nice to have you here.
It's nice to be here.
Yeah, it's good to see you on TV, not behind the microphone
Exactly.
and radio.
Right.
Yeah.
So
Cleaned up today.
You look good.
I'm a pain in my co-host's neck as well.
Yes. This, I know
But
you're
you were-
joking about it now,
But
this
you
has
had
been
all kinds of
serious.
problems going on. What was going on?
I did. I had a spinal stenosis, which is C6 and 7 in my spine in 2011, pinched nerves. And so I actually had to have surgery. I had to have emergency surgery. So I had never been to a chiropractor before. Briefly, a couple visits prior to having to have surgery. So obviously my back problem had gone way too far. Then I saw Dr. Drew on your show repeatedly, and basically like
He
people.
caught me on the way out.
He
one
accosted
day.
you in the hall.
I did. I told myself,
Yeah.
I'm like, if he's ever on the show again, I gotta grab him.
Why was his message compelling to you? Even after having surgery, what was he saying that resonated?
Well, it was different than anything that I had heard before, which is, you could talk about the procedure, which is the upper neck.
Yeah. The NUCA procedure, basically, it's a very specific treatment to the top of the neck that allows us to balance out the entire body posture. And with most neck and back pain, it's not a problem that starts in the low neck or the back. Rather, it's a full body imbalance that then degenerates the low back and the neck. So if you just treat the neck and the low back, you never really get to the underlying problem. But we actually balance out the entire posture where we're able to see some results that more specific areas of treatment don't get.
We'll talk about this idea of balance and imbalance, but
Yeah.
Jeff, complete this idea for us about just how much the pain was affecting the day-to-day for you.
Yeah, I had, well, basically I had lower back pain, but when I went into doctors, they always said, well, you've got this really big problem up here. So I think just it exacerbated everything. I had my legs were misaligned. One was longer than the other, just from years of your body trying to compensate. So even though I had surgery, that was never going to rectify that same kind of, misalignment. So that was the deal with spinal balance, going in there, and pretty quickly he got me lined up, and I could notice that I don't feel like I had a left leg that was basically kind of like a drop foot kind of deal.
Yeah.
And that's gone away.
Wow.
Yeah, so you trapped Dr. Drew Drummond in the hall. He gets you into the clinic. How long after you maybe stopped in for a visit did you get some relief?
I would say after probably the second, I thought, actually I felt relief right away. But I wanted to give it a few weeks before I really started kind of preaching it. And so I've been kind of a quiet little preacher, like, man, I don't know. I'm like, I think it's working.
Is
Yeah.
this story common?
Yeah,
Doctor?
we hear it all the time. There aren't many places that people can go and get their full body balanced back out. So we hear a lot of these year-long or several year problems that then we adjust their atlas, balance out their posture controlling mechanisms, and they start feeling better.
He mentioned chiropractic care, but what you do is highly specialized. NUCA is the form of care.
I certainly practice under a chiropractic license, and there's just a bunch of wonderful techniques out there, but mine revolves around a very specific treatment to the top of the neck, because when that top bone is out of place, the more specific you can be with that correction, the better result you can have getting those nerves functioning better to control the body's posture.
Yeah, I know that we try to catch a lot of patients and get them into you before they make that step into surgery. Now, Jeff already had surgery. Do you work with a lot of patients post-surgery?
We get them pre, we get them post, we have them after they've had multiple surgeries. One of the worst things that can happen is a person sits, like here on this picture, you can see an imbalanced body on the left side versus a balanced body on the right side. And when the posture's mechanisms are working correctly, you'll look like the guy on the right. But when the nerves at the top of the neck are not functioning correctly, you'll have shoulders uneven, hips uneven, legs uneven, and then you have to compensate for all that. So over years of compensation, it leads people into surgery. But even after surgery, if you don't correct that issue, you're just ready for the next surgery. And the surgeons will warn you about that. They'll say, we're going to fuse C5, C6, but we got to watch out because either the joint above or below is going to start wearing out, and it's because the compensation just moves. You have to get balanced out, even if you had a surgery.
But this is so gentle. Like, we think about the most invasive thing possible is surgery, and then on the other side of the spectrum is NUCA.
Yeah.
How gentle? Would you describe these adjustments
Were you
for our viewers?
anticipating cracking and popping?
Yeah,
going on?
I had gone to chiropractor. I mean, the regular ones where they're kind of adjusting you, which could feel jarring. I'd only done 2 visits, and that scared me off. Not saying that it wasn't maybe going to work. But this is right up here, and it's these gentle little adjustments, and it's in and out the maintenance stuff. So I was going once a week, and then now it's every 2 weeks.
I think you're almost ready to be coming in a month.
Once a month.
Yeah.
He's like, I don't want to see you much anymore. Get out of here.
Oh, Dr. Drummond's a good guy.
No, I'm saying that's what he's saying to Jeff.
Right.
But you said you're preaching it, so you are recommending it to friends and family.
I mean, when you get relief on something like that, you really become a fan. So I have to be honest, this year when I was golfing, for the first time on 9 holes, I broke 40. I had like a 38 or a 39. I'd never done that before. And I thought, man, I wonder if it's and I swear to you, the next visit, he's adjusting. He goes, hey, you golf much? Because you might see an adjustment in your golf game a little bit. Since we've got you lined up more, you might get a little bit. I'm like,
it happens all the time. Maybe we should bring golfers in here
No
sometime.
kidding.
We haven't talked about that
Golfers
yet.
are going to start calling you any time now.
But the big deal is the day-to-day, to where you feel like you've got your life back. You can do things comfortably, and it's not holding you back anymore.
Yeah, I think I probably put up with it for way too long, and so this was an easy process.
We have a special offer which Dr. Drummond brings just to our viewers. The first 15 people who call his office receive a consultation, an exam, and x-rays for $50. No need to corner him in the halls here. Just call. Medicare patients are not eligible. Heads up on that. We'll show you the phone number here too. And while we look at this information, Dr. Drummond, a quick word about how do you know if you're a candidate the way Jeff was?
It's really quick in my office because I can just look at somebody's posture, I can measure their hips, I can do a leg length check, and there's very specific things that will happen to a person when their atlas is off. So just really looking at the person, then eventually taking pictures to really identify the problem.
Doctor, thanks for your time today. Jeff, get back. You got a radio show to finish off.
Thanks, guys.
Good to see you.
We'll see you next month for the diaper drive.
Yes, we will.
You
You'll
will.
be in here.
So Dr. Drummond has been on the show several times before. To hear other patient stories, go to OmahaMorningBlend.com, type spinal balance into the topic bar at the top of the page.